Hello, my name is Robin Stinson, and my presentation is on bedside reporting. Bedside reporting is important because it helps reduce patient failures during the most crucial time during a patient's handoff. That's during the time that the patient is being transitioned from one nurse to another during shift change. Hospitals are placing more importance on patient satisfaction and safety in order to regain their magnet status and certifications to improve their reputation in the community. Satisfaction scores increase when the patient feels safe. So the problem we have here is 80% of medical errors are attributed to miscommunication. When the patient is when there's miscommunication among caregivers, the patient reports those errors. Therefore, you have satisfaction issues. So the greatest risk for communication in healthcare environment is during that shift handover. Verbal reports alone causes miscommunication. Incomplete information communicated poorly between the caregivers can be attributed to interruptions and disruptions that are caused during that shift change, because there's a lot of distractions that can be going on during the chaos that happens between that time period. Evidence-based practice causes us to research, and this evidence is links us to improvement in patient satisfaction scores by bedside handoff models. Demonstrate the great potential of impact is by patient satisfaction, including patients in care decisions, keeping them informed, which means that when you keep your patient informed, they are happier, which obviously keeps the patient, when you take the patient into consideration, informing them about their test results keeps them happier. They're going to make you, they're going to report that as far as their surveys are going to come back positive. When you have handoff related care failures, they're gonna decrease if you have more standardized evidence-based handoff process, using like a standardized tool to take a standardized tool in use of your bedside care. Then that's going to decrease the number of patient errors. If you use a type of tool to standardize your care, then you're less likely to have those patient care errors. It's going to promote safety and accountability and teamwork by using that type of tool, because everybody's going to have that same type of tool, so they're going to be accountable. Each person is going to be accountable by using that same tool. It's going to increase safety because they're all going to have that same tool. They're all going to have to be, they're all going to be, using the same tool. It's going to keep their client's safety by not having that miscommunication, and it's going to promote trust by being able to be in front of the client and having the discussion with the client and the oncoming nurse. And so it allows for the discussion of care to occur at the bedside. By having this discussion with the patient and the oncoming nurse, it increases patient and nurse satisfaction. This information, by discussing wait times, pending test results, like I said, it increases the patient satisfaction. It's also been known to increase nurse satisfaction, because when the patient's happy, the nurse is happy. The increase in patient safety comes when the distractions and interruptions cause the loss of information and inaccurate information is being conveyed to the next shift. When you have that standardized tool that you use, you won't have as many errors because all the information, all the pertinent information will be written on that particular tool. So everything you need should be written on that specific tool, so there will be no room for error on that sheet. You're going to have more of a patient safety issue. You're going to have accountability to your coworkers and to yourself as well, and it's going to promote teamwork because you're going to have to work with that team member, and your patients are going to value that teamwork because you're going to be it's going to be witnessed because you're going to be at the bedside performing that task. When you involve your patients in this care, it promotes patient engagement. It also promotes empowerment. Patient feels like they're in charge of their care. It promotes them to have to be involved in all aspects of their care. When they are empowered by their health care, they're more involved in participation in their care. They might be more willing to follow up with their care and get better treatment for their care as far as follow-up care with their physicians and take better care of themselves. But change is hard sometimes. Nurses still remain uncomfortable with talking in front of patients. Sometimes you don't really want to talk in front of the patients, and some things can't be said in front of the patients, and there still will be a time that you have to kind of set aside that you need to talk away from the patients because some things still can't be said in front of the patients. But you do have to have some requirement of active participation will be necessary. But hold 1 second. I'll just have to do it from here. So I don't know how to make it. I'm sorry, 1 second. Okay. But you will have to be an active participant. You will have to be an active participant in the project because without it, it will fail. And if poor communication continues, the patient safety will be at risk, and the trust that you have established will no longer be there. In making this project, you'll need to develop that tool by creating that bedside model. Probably need to establish a tool that will be effective for every department, that you would encounter ICU, Med-Surg, and the ER as well. Distribute surveys to the patients that following their care so that you can get feedback in case they want to provide feedback on the process after, in case it needs to be tweaked or changed. Also feedback from the nurses as well. The staff needs to be informed of the changes and also in services to educate the process. So the plan will be to develop that. You'll train the staff, follow the implementation, and follow up with the surveys and reevaluate it. So let's do the right